Can tardive dyskinesia be mistaken for dystonia in people with schizophrenia? Have you ever wondered if tardive dyskinesia can be confused with dystonia in individuals living with schizophrenia? This is an important question, especially when considering the complexities of mental health and its treatments. Let's break it down. Tardive dyskinesia, often referred to as TED, is a movement disorder that arises from long-term use of certain antipsychotic medications. This is particularly common with older, first-generation drugs. People with schizophrenia who have been on these medications for an extended period may experience involuntary and repetitive movements. These movements often occur in the face, such as lip smacking, tongue thrusting, and rapid blinking. However, they can also affect the trunk, arms, and legs. On the other hand, dystonia is another type of movement disorder. It involves sustained or repetitive muscle contractions, leading to twisting movements or abnormal postures. Dystonia can be painful and may affect any part of the body. Unlike tardive dyskinesia, dystonia usually appears much earlier in treatment, sometimes within hours or days of starting antipsychotic medications. Both tardive dyskinesia and dystonia can occur in individuals with schizophrenia, primarily as side effects of antipsychotic medications. However, they present differently. Tardive dyskinesia is characterized by involuntary movements, while dystonia is marked by sustained muscle contractions. This difference can sometimes lead to confusion, especially among those who may not be familiar with the specific features of each condition. It is essential to distinguish between these two disorders for effective treatment. Tardive dyskinesia is often irreversible once it develops and may require changes in medication or additional treatments. Dystonia, if identified early, can often be managed by adjusting the medication or using specific medications to relieving muscle spasms. For individuals with schizophrenia, experiencing movement abnormalities can be distressing. These involuntary movements might even be mistaken for symptoms of schizophrenia itself, like disorganized behavior. However, it is crucial to understand that most of these movements are side effects of medications. If you or someone you know with schizophrenia starts to experience new or worsening involuntary movements, it is vital to consult a healthcare provider. Accurate diagnosis is key, as the treatment plans for tardive dyskinesia and dystonia differ significantly. In summary, while tardive dyskinesia and dystonia can both cause abnormal movements in individuals with schizophrenia, they have distinct causes and patterns. Understanding these differences can lead to better management and improved quality of life for those affected.